You're sleeping peacefully like a baby, sweet dreams, warm blankets, cozy bed. Suddenly, aha! Your calf muscle cramps up like someone just pulled a giant rubber band inside your leg. You jump out of bed, hopping around like you're trying to perform a weird dance in the middle of the night, groaning in pain. Sound familiar? Welcome to the 3 a.m. Leg Cramp Club, a place nobody wants to join, but everyone's visited at least once. Nighttime leg cramps are super common, yet rarely talked about in a simple way. So why do they happen? And how can you avoid those sudden, painful, muscle pulls in the middle of the night? In today's video, ClarityMD will explain everything you need to know about nighttime leg cramps, helping you understand your body better and giving you practical tips you can use right away. Before we dive in, if you find this channel helpful, please like the video and hit the bell so you won't miss easy but valuable health tips every day. You're watching ClarityMD, where we explain everyday health topics in a friendly, clear, and fun way. Let's get started. So, what exactly are nighttime leg cramps? Nighttime leg cramps, known medically as nocturnal leg cramps, are sudden, involuntary muscle contractions that mainly happen in the calf, foot, or sometimes the thigh, usually during deep sleep or rest at night. The muscles involved, especially the gastrocnemius and soleus muscles in the calf, suddenly contract very strongly, causing sharp pain that wakes you up, making you jump out of bed as if someone just kicked you. These cramps can last from a few seconds to several minutes, and the worst part is you can't control them. All you can do is wait for it to pass or try to stretch the muscle by hand or stand up and walk around. After the pain, the muscle might ache for hours, similar to how your legs feel after playing a full 90-minute soccer game. A little science: cramps happen because the motor nerves that control the muscles get suddenly and excessively stimulated. This condition is very common, affecting about 33% of adults over 50, but anyone can get it, from teenagers and athletes to people who just binge-watch Netflix all day. Here's a funny example. You're dreaming happily, holding hands with your crush, strolling through Paris, when suddenly your calf twitches like you just got zapped by electricity. Dream shattered. You clutch your leg, groaning in pain and discomfort. In the dark, you hop around the room like you're practicing K-pop dance moves, but without the music. The thing is, nighttime leg cramps aren't life-threatening. But if they happen often, they disrupt your sleep, lower your quality of life, and sometimes signal underlying health issues. So why do these cramps strike while you're asleep? And how can you stop those sudden 3 a.m. pain attacks? So, why do we get nighttime leg cramps? You already know that nighttime leg cramps are like an uninvited show happening in your muscles, but who's the main actor causing your muscles to throw such a wild party? Let's check out the usual culprits. 1. Electrolyte imbalance. The muscle troops running low on fuel. Minerals like calcium, magnesium, and potassium are the ammunition that help your muscles contract and relax smoothly. When you lack them, your muscles get stiff and cramp easily. For example, if you sweat a lot playing sports but don't replenish electrolytes, your muscles might go on strike that very night. Or if your diet lacks enough veggies, bananas, dairy, or nuts, you're more likely to miss these important minerals. 2. Dehydration. When your muscles get thirsty and rebel. Muscles are like machines that need enough coolant to run properly. If you drink too little water or lose fluids from heat or exercise, your body becomes dry and muscles can suddenly spasm. Imagine driving a car without enough oil. The engine makes weird noises. Your calves behave the same way. Pro tip: drink enough water, especially in the afternoon and evening, so your calves stay cool before bedtime. 3. Strange sleep positions. When your sleeping posture traps your muscles. If you sleep with your knees bent for too long or curl up your legs too much, nerves and muscles can get compressed. It's like pinching a garden hose. No water flow means the pump squeals. For example, curling your legs up close to your belly or resting your feet on the edge of the bed can irritate the calf nerves. This position makes your calves tense and more likely to cramp while you sleep. 4. Muscle fatigue or overuse, when your muscle troops are overworked. After a long day of standing, running, or heavy gym workouts, tired muscles are prone to cramping at night as a kind of warning signal. Remember, muscles need time to rest and stretch properly to recover. So if you ran a marathon or climbed lots of stairs today, don't be surprised if your calves throw a midnight tantrum. 5. Age. Older muscles get more sensitive. As you age, muscles and nerves become more sensitive to stimuli, making cramps more common. Like an old car, the longer you use it, the more careful maintenance it needs to run smoothly. Older adults often have more cramps due to poorer blood circulation and muscle changes. 6. Less common causes, the mysterious ones. Sometimes nighttime cramps are linked to circulation problems, like weak veins, that reduce oxygen and nutrients to muscles. Side effects of certain medications such as diuretics or blood pressure drugs that upset electrolyte balance. Some neurological or metabolic conditions, rarely, can also contribute. 7. Cold weather, when your calves shiver, like they're freezing. Muscles can be quite fussy about temperature. Sleeping in a cold room or during winter can cause your calves to cramp more, as your body tries to keep warm. Just like when you're outside in the cold and start to shiver, your muscles automatically contract to generate heat. At night, slower blood circulation makes it harder for blood to flow, so muscles get more excited and prone to cramping. Many people say their calves dance at night during winter. If you sleep in a cold room, wear long pants, use warm blankets, or try a heating pad to keep your calves cozy. So, who usually gets nighttime leg cramps? You've learned when and why leg cramps tend to drop by at night. But have you ever wondered, what about regular people? Are there some lucky ones who get cramps more often than me? The answer is yes. Let's meet the VIP members of the Nighttime Cramp Club. 1. Older adults, the original Grandpa and Grandma Cramp Squad. As we age, muscles and nerves get worn out and become more sensitive to even tiny triggers. Blood circulation slows down too, making calves prone to sudden cramps. Your grandparents, parents, or even you past 50 might have woken up in the middle of the night because of those evil cramps. Think of cramps as your body's cheeky way of saying, "Hey, take better care of me." 2. Athletes or people who exercise a lot, the muscle warriors with trouble. If you're hitting the gym, running, playing soccer, or doing any high-intensity muscle work, don't be surprised if your muscle troops revolt once you hit the bed. Overworked muscles get tired and need rest. Without enough recovery or minerals, cramps will pay a visit. Like an Olympic athlete, your calves need special care too. 3. Pregnant women, the captain of nighttime cramps. Especially in the last trimester, many moms-to-be get nighttime cramps because of the growing belly's weight, pressure on blood vessels and nerves, plus hormone changes affecting muscles. It's a real, ouch, when you're drifting off to sweet dreams and suddenly your calf wakes you up. Pregnant moms should pay special attention to calcium, magnesium, and keeping warm. 4. People who stand or sit for long periods, the cramp's best friends. If your job keeps you standing still or sitting a lot, like salespeople, drivers, or office workers, you're also at risk for cramps. Poor blood flow leads to stiff muscles, and cramps can ambush you unexpectedly. Remember to stand up, move around, or stretch gently to keep your muscle troops alert. 5. People who are dehydrated or eat poorly, the victims of the low-fuel squad. Drinking too little water, having a mineral-poor diet, or drinking lots of alcohol makes your body dehydrated and low on electrolytes. A perfect invitation for cramps. You might think of nighttime cramps as a side effect of an unhealthy lifestyle. So, how to avoid nighttime leg cramps? Nighttime leg cramps can be really annoying, but the good news is, you totally can vote them out of your bedroom. Here are 7 detailed tips to help you defeat cramps and enjoy a full, restful night's sleep. 1. Drink enough water. Refuel your muscles. When you're dehydrated, your muscles get dry and thirsty, making cramps more likely. Don't wait until you're thirsty to drink. Sip water steadily from morning till night. For example, try placing a water bottle by your bedside so you can easily drink if you wake up at night. Just don't overdo it, or you'll be rushing to the bathroom. If you tend to forget, set reminders to drink water in the afternoon and evening. 2. Get the right minerals. Ammo for your muscle troops. Minerals like calcium, magnesium, and potassium are key to normal muscle function. Without them, your muscles can rebel and cause cramps. Eat bananas, oranges, avocados, leafy greens, milk, cashews, pumpkin seeds, and beans for a natural mineral boost. If you're prone to cramps, athlete, pregnant, older adult, talk to your doctor about calcium or magnesium supplements. 3. Stretch before bed. Cool down your muscles. Spend 5 to 10 minutes stretching your calf muscles with simple moves like: stand straight, place your hands on a wall, keep one leg straight and press your heel down while bending the other leg slightly. Hold 20 to 30 seconds, then switch. Sit on the floor, legs straight, wrap a towel around your foot, and gently pull it toward you to stretch your calf. Rotate your ankles clockwise and counterclockwise a few times. You'll feel your calves relax, like a nice cool down before bedtime. 4. Keep your feet warm. Cozy jacket for calves in cold nights. Muscles are super sensitive to cold, so don't let your calves freeze overnight. Wear cotton or soft wool socks, use warm blankets, or heating pads to keep your feet warm. If you prefer a natural touch, rub some warming balm or cream on your calves before sleep to boost circulation. 5. Sleep in a comfortable position. Don't let your legs do acrobatics. Sleeping awkwardly can bend or overstretch your muscles, causing cramps. Avoid curling your knees too tightly or tucking your legs close to your belly. If you sleep on your side, try placing a soft pillow between your knees to keep your legs straight and relaxed. 6. Light movement. Dance away the cramps. If your job keeps you sitting or standing for long hours, move gently every hour. Stand up and walk around for a few minutes. Rotate your ankles and stretch lightly to improve blood flow. Try light exercises like slow walking or yoga. Imagine you're a dancer in a show. Keep moving smoothly so your muscles don't get lazy. 7. Massage and care for your calves. Secret to soothe your muscle troops. Gently massage your calves before bed to boost circulation and ease tension. Use your hands to rub from your ankle up to your knee with gentle strokes, using palms and fingers. You can also use a small massage roller or a tennis ball to roll along your calves. Adding some warming oil or peppermint essential oil can enhance relaxation. With these tips, not only will you push nighttime cramps away, but you'll also enjoy better sleep and a healthier body every day. Remember to practice regularly and patiently. You'll notice the difference soon. When should you see a doctor? Alright, you've armed yourself with plenty of weapons to fight off those nighttime leg cramps. But sometimes the enemy just won't quit that easily. So, when is it time to make an appointment with a doctor for some professional help? Here are some signs you shouldn't ignore. 1. Cramps happen frequently, every night or several times a week. If you're hit by cramps not just once but multiple times a week, or even get attacked every single night, it's definitely time to get a doctor's advice. For example, if your muscles feel like they're throwing a wild chase party, and you're not getting real rest, you should see a doctor. 2. Cramps come with pain, swelling, or redness in the calf area. If besides cramps, you feel sharp pain, notice swelling or redness and warmth in your calf, it might not be just a simple cramp. It could be signs of other conditions like muscle inflammation, vein inflammation, or even a blood clot. This is the moment you need a doctor's checkup to avoid serious complications. 3. Cramps come with other symptoms like numbness, weakness, or loss of sensation. If cramps come along with numbness, tingling, muscle weakness, or loss of feeling in your leg, it could be nerve damage or circulation problems. You should get checked to get an accurate diagnosis and timely treatment. 4. You have underlying conditions like diabetes, kidney failure, or nerve diseases. People with chronic illnesses such as diabetes, kidney problems, or nerve diseases are more prone to cramps due to electrolyte imbalances or nerve damage. If cramps occur frequently, a specialist doctor should evaluate and adjust your medications accordingly. 5. Cramps happen after injury or surgery. If you've recently had an injury or surgery on your leg and experience cramps with severe pain, see your doctor to rule out any complications. 6. Cramps cause serious sleep loss and affect your quality of life. If cramps keep you from sleeping well, leaving you tired and stressed, don't hesitate to seek medical support and advice. Though cramps seem small, they pack a punch. If left untreated, they might become uninvited guests who visit often and disturb your health. Nighttime leg cramps are a very common phenomenon. They may seem like just a minor nuisance, but if they happen often or come with other unusual signs, they could be your body's way of warning you about an underlying health issue. We've explored common causes such as dehydration, mineral imbalances, cold weather, sleeping positions, and groups of people who are more prone to cramps. At the same time, you've been equipped with simple yet effective tips to prevent and reduce these cramps, helping you enjoy better sleep without those uninvited guests disturbing your night. I hope today's video helps you better understand your body and take proactive care of your health, keeping those annoying leg cramps at bay. If you found this video helpful, please like, share it with your friends and family, and don't forget to subscribe to Clarity MD to continue joining us on this journey of exploring common, but not always easy to understand, health issues. See you in the next video.